I'm Olivia. I'm the Population Health Program Coordinator here at Ellenville Regional Hospital, part of a Rural Health Network. And today I have Dr. Christina Ursitti with us, and we're going to talk about the importance of cervical cancer screenings as it's January. So be sure to get screened if you're eligible, and stay here to find out more.
Perfect.
So, for anyone who's not familiar with the female reproductive system, we're going to start off with just talking about what the cervix is and where it's located.
Yeah, so the cervix is this organ right here. We can't really see it because it's clear in this picture, but you have your opening to the vagina here, and then here's the cervix and here's your uterus. So if we're looking at it in a different way, we'll have the vagina here, and then this piece right here is the cervix, and then the uterus is up top.
And then what is the cervix, like what does it do? What are its functions?
So, great question. It kind of keeps the uterus in place, and its main function is when really there's a baby in here, right? So the only thing that's keeping the baby in is the cervix, and we'll hear dilation a lot of times when we hear about like people in delivery and going through labor. So the cervix is actually the organ that's dilating.
Right.
Yeah, so that's what's getting bigger, so the baby's head comes out.
And then I guess what about your period and things like that? That's where blood comes through, or menstruation?
Yeah, so it kind of it builds up here, and then you'll see it come out the cervix. Yeah.
Great, thank you. Okay, and then going into a little bit more about cervical cancer, what is cervical cancer, I guess?
So cervical cancer is a cancer specifically of this organ here, the cervix, right? But it can spread, but it's a very slow spreading cancer for the most part, which is why we try to have everybody get their pap smears. So what a pap smear does is it'll tell us if there's any abnormal cells in the cervix. So that's where we're taking a sample of that in order to tell if there's anything that may be going on that may be leading to cervical cancer.
Great. And then what can put someone at risk of developing cervical cancer?
So one of the main risk factors for developing cervical cancer is the human papillomavirus, or HPV. There's probably over 200 types of this virus, so you'll hear numbers getting thrown out. But the main ones that we're concerned about is the high-risk HPV, which is generally numbers 16 and 18. But those...
Sorry, what does that mean, numbers 16, 18?
So there's like 200 types
got it.
of human papillomavirus. So those are just some numbers. Specific strains. But those are the ones that we know can cause cervical cancer.
Okay. And then I guess what can cause HPV? Is that more like genetics or?
Great question. So it's pretty hard to tell where it came from. It's just a virus. So we don't know if it's transmitted through the birth canal. We do know that it can be a sexually transmitted disease. So that could be a possibility of how you would get HPV. But like I said, we don't really know.
Okay, great. Thank you. And kind of like going back to, I guess, the cervical cancer screening side is what's the best way to detect and promote early detection of cervical cancer?
So we kind of breezed breezed past it, but it would be getting a pap smear, which is something that you can do either with your family practitioner or your OBGYN. And it is a pelvic exam, which you get completed with a speculum. So this is the speculum. We have a little pull tab here, and it has a light on it. I don't know if you guys can see the light. But the way it works is we would go into the opening of the vagina. You'll go in, and then we would open this up just a little bit so we could get a great view of the cervix. Once we can see the cervix, we take samples of it. There's a couple different tools, and there's no reason why one provider would use one tool versus the other tool. It's really preference. But if you want to feel these are really soft. That one is almost like a mascara brush, putting on mascara. And this one, I mean, you can kind of see this one's pretty flexible as well. Some women don't even feel when we're actually taking the samples of the cells. Some people may feel a little bit of cramping, but for the most part...
That's a common thing you hear, I think, when you're younger, that they're really painful. Yeah. And so is that more of a myth or kind of body?
Everybody has a different pain tolerance. Everybody has a different sensation tolerance, and it also is different with the experiences that you've been through in your life. So There's some people that have a tough time getting pap smears, and it's important to have a provider that you're comfortable with and you can share your experiences with, and also let them know how you're feeling during the exam. Because it can be a really quick exam, or if we need to take time and take some breaths and relax, that's an option as well. So it all is patient dependent and provider dependent. Yeah.
And then I guess we kind of went over a lot of the pap smear side, but a little bit more would be like who's eligible, what are recommendations around getting screened and how often?
Yeah, great. So it used to be, and this is like back in the Stone Ages, right? People say as soon as you're sexually active, go get a pap smear. So not true. We don't start screening people for cervical cancer until they're 21. So the first time you would get a pap smear would be 21. From 21 to 30, as long as your cervical cancer screenings are normal, we say you come in once every 3 years, so it's not even an annual screening. You can come in if you have any questions about STDs or discharge or anything like that, but as far as the actual pap smear cervical cancer screening is once every 3 years from 21 to 30 years old. Once you hit 30 years old, it actually increases to every 5 years. So then it's once every 5 years when you hit 30 to 65. And then when you're 65, as long as everything's normal, you're done with your screening.
Okay, great. And what kind of results can come out, like say it's not a normal result? What other options are in there, and when? Yeah.
So there's a lot of different things that we can see. So you can see normal cells, no change in cells. You can see something called ASCUS, which is change in cells with undetermined significance, which is like, what does that mean? Is it significant? Is it not significant? And that's exactly what we would follow up on. So sometimes if the HPV is positive, we would go one way. If the HPV is negative, we would go a different way. It's really a pretty complicated system. But once your provider tells you, listen, you have some abnormal cells, either the next step is repeat the pap in a year, so decreasing that interval, or going for the next step, which would be like some sort of a biopsy or a colposcopy, where they would take little pieces and really take a closer look at to what those cells are changing and why.
Okay, great. And then, let's see, I guess going into, we've talked about HR-HPV testing before, HR-HPV, and what would testing for that look like? Because I know sometimes especially once you get past the 21, 23, usually they can recommend getting both HR-HPV and the cervical cancer, and the pap smear testing at the same time.
Great question. So it's really just a difference in what we order, right? So what the provider orders. It's the exact same testing, the exact same tools, it's the exact same everything, it's just the difference in the order. So from 21 to 30, we'll do a pap smear with reflex HPV. So that means we will only run HPV if something comes abnormal in your cells. Okay, after 30, we run the pap smear plus the high risk HPV, which is the HR, so the high risk HPV, automatically. So we're running those simultaneously, same test, same exam, same everything.
So there's no new equipment being...
Nothing you wouldn't even know.
Okay, sounds good.
Yeah.
All right. Well, those are all the questions I have. And if you ever have any other questions that are outside this video, you can always talk more to your provider. Or Dr. Ursitti, if you're seeing new patients, do you have any numbers that can be called? Or?
Yep, so we're over at the Institute for Family Health. We have family medicine providers there that do women's health, pap smears, birth control, prenatal care. So if you have any questions or want to schedule your exam, our phone number is 845-647-4500, and that's Ellen Bill Family Practice.
Great.
Thank you.
Thank you so
Thanks.
much.
Happy New Year.
Happy New Year.